Good morning, everyone. I'm so glad to see such brilliant students again. I hope you all are doing great.
Good to see you, Dr. Hassan. Actually, we all were discussing how much we are afraid of performing arterial sampling for ABGs.
Well, nothing in life is to be feared. It is only to be understood. That gives me an idea that why don't we discuss how to take ABG sample. I'm sure that after fully understanding the procedure, no one out of you will be fearful of this procedure. So, without wasting any time, let's go through the steps of performing an ABG. First, we need to gather our supplies. Now, can anyone tell us the list of items that what we need to perform ABG?
Of course, Dr. Hassan. We need a heparinized syringe so that the blood doesn't clot before it reaches the ABG analyzer. Then we must have alcohol swabs to make the site sterile. Furthermore, we'll require gauze and a bandage for the dressing after the procedure. Oh yes, we'll also need gloves for our protection, a biohazard bag to dispose off the used equipment, and a patient label to identify the sample taken.
Excellent. Now, the next step is patient preparation. How do we explain the procedure to the patient?
We should explain that we need to take a blood sample from an artery, usually in the wrist, to measure their blood gases. We should inform them it might be a bit painful.
Correct. Always ensure the patient understands and consents to the procedure. After that, what do we do next?
We should perform a modified Allen test to check for collateral circulation in the hand.
Precisely. For those who are unfamiliar, can you describe how to perform the modified Allen test?
Sure. First, ask the patient to clench their fist tightly so that the blood exsanguinates from the hand. Then compress both the radial and ulnar arteries. This blocks any arterial inflow to hand. Next, ask the patient to open their hand, which should appear pale by now. After that, release the pressure on the ulnar artery only, keeping the radial artery still compressed. Now observe if the hand flushes and turns pink. If it does, that means that the ulnar artery is patent and there is adequate collateral circulation and that it is safe to proceed with drawing the blood from radial artery.
Absolutely correct, well done. If the Allen test is positive, we can proceed because now we are sure that even if some iatrogenic damage is done to the radial artery while drawing the blood, the ulnar artery is patent and will salvage the hand. Now let me tell you about the technique for obtaining the sample. The commonest site for obtaining blood for ABGs is the radial artery, from the non-dominant hand of the patient. The non-dominant hand is preferred to ensure that patient can give adequate time to rest this hand so that the arterial puncture site is sealed, preventing hematoma formation, as this may need at least 5 minutes of pressure. Furthermore, the radial artery is preferred because it's superficial and has good collateral circulation. Now, how should we position the patient's arm?
The arm should be extended with the wrist slightly hyperextended. We can use a rolled towel under the wrist to maintain this position. By hyperextending the wrist, we ensure that the patient's hand is not hindering the sampling procedure.
That's spot on. Okay, now, after positioning the arm, what is the next step?
We should palpate the radial artery and clean the site with an alcohol swab.
Excellent. Palpate the radial artery over the wrist of the patient's non-dominant hand to identify an ideal puncture site. You should use the tips of your fingers to clearly map out the course of the radial artery and then identify a distal site where the artery is most pulsatile. The radial artery is typically most superficial over the lateral anterior aspect of the wrist. Once you have identified your planned puncture site, clean it with an alcohol wipe for 30 seconds and allow it to dry before proceeding. Now remove the cap of the heparinized ABG syringe and hold it with 2 fingers of your dominant hand, like a pen or a pencil. The needle bevel should be facing upwards. Insert the needle just under the skin at a 45 degrees angle, aiming in the direction of the artery, slowly advancing it in one plane while palpating the radial pulse proximal to the puncture site with your non-dominant hand. Continue to advance the needle slowly towards the pulsation until you feel a sudden reduction in resistance and see a rush of blood back into the ABG syringe. This is known as flashback. The ABG syringe should then begin to self-fill in a pulsatile manner, pushing back the plunger.
That's what we fear most. What if we miss the artery and blood doesn't fill up the syringe?
Well, the solution is simple. If that doesn't happen, it may indicate needle has gone through or missed the artery and therefore need to readjust the needle based on your understanding of the course of the radial artery. For example, change in angulation or slight withdrawal of the needle. Okay now, once 2 to 3 milliliters of blood has been collected and the needle has been removed, what should we do next?
Immediately after we remove the needle, we need to apply a firm pressure to the site with gauze for at least 5 minutes to prevent bleeding and hematoma formation. Secure the sample, remove air bubbles, and label it. Dispose of the needle in a sharps container and the rest of the waste properly.
Perfect. Finally, what are some potential complications we should be aware of?
Hematoma formation, arterial spasm, and rarely arterial occlusion or infection.
Correct. Always monitor the patient for any signs of complications after the procedure. Great job, everyone. Any questions?
I wonder if there are any conditions in which we should avoid performing an ABG on patient.
Oh yes, that's a very pertinent question. We should avoid it in patients with a negative modified Allen test, known coagulopathy, severe peripheral vascular disease, or infection at the puncture site.
Thank you, Dr. Hassan, for making the procedure so easy to understand.
You're welcome. Remember, practice and proper technique are key to performing ABGs safely and effectively. See you all next time and happy learning.